Many young people are dying due to overdose on hard drugs. We are all left wondering how this horrible thing happened at our watch. To understand how addiction starts and how to prevent it, then let's go back to our younger days. While we appreciate that each addiction situation is unique, there are 3 common factors teens have a lot to cope with. Many are trying to figure out, who am I? What is my identity? And stressed at the same time. To deal with stress and pressure in school and others' stress at home. This could be money issues, death of a loved one, parents' divorce, emotional neglect, abuse, addicted family member. Many of them have to cope with anxiety and depression. And some of the teens may be having poor coping skills. Maybe their parent or parents are tied up with other activities, or are struggling themselves and may not even realize that their teenage child needs help, making them unable to teach the kids healthy coping skills. And for kids who are struggling, they may develop bad self-image, making it hard to cope. Biochemical issues. Some are affected by how their brain chemical processing works, making it easier for them to get hooked to drugs. This could be an hereditary trait, but it is not always present in all cases of addiction, but it increases the chances of getting addicted. Any one of this can make one susceptible to addiction. Now, how does addiction happen? With poor coping skills, teens might resort to trying alcohol and other drugs. At this point, partying friends might become their identity point. With continued use, the brain gets to understand that alcohol offers a temporary solution to their problem and helps them forget the stresses they have. This is a maladaptive approach and could become their permanent solution. They become willing to try anything. One starts using drugs more frequently, and this is where things break loose. Due to increased use of drugs, the brain learns that alcohol and other drugs can help reduce stress. In turn, this causes 3 things. 1. It becomes an automated response, and when stressed they reach out to drugs without even having a second thought. 2. It changes the brain chemical processing pattern. 3. It worsens life situations since it isn't a permanent solution. 3. Hence creating the need for more and more drugs. If this trend is not halted, there are 3 things that will follow. Either jail, institutions, or death. By institutions we mean addiction and other drug-related health complications. At least 1 in 10 adults struggle with addiction as per statistics. Addiction leads to death, broken families, shattered dreams, and extreme mental illnesses. Now, how do we prevent addiction? Here is a quick guide on how to. Parents, here are some tips to help your teen child